You know, when I was thinking of what am I going to say to y'all, I respect y'all so much and I don't feel that I can teach you anything. And I started with a title, and I realized that my title probably has several titles. I've come up with several titles since. And I think a calling to service is what I first came up with. But then I think the other title that I came up with, why am I here? Who put me here? Why do I choose to be here? And then I started to think of my audience, and I settled on my kids. This is a message to my kids, Blake, Zane, and Colt. You know, I'm a father, I'm a husband, I'm a Presbyterian by faith and by grace, and I'm a family and community physician. And I think of all the most important roles of those that I have, it's not being a physician. I'll be replaced someday as a physician, and that's okay. I choose not to give up my faith. I hope I never do. I don't want to be replaced as a husband. I love my wife. But I know that my most important role is that of a father. I cannot be replaced as a father. And I know that my children, for me, are my legacy, not my practice, not what I do, but what I teach my kids. Hopefully what I inspire to my kids, not by my voice today or my lecture today, as they'll call it, but by hopefully my actions. To me, being a physician is an incredible privilege. I'm so blessed, and it gives me such opportunity to try and do good. And for me, going to medical school was enabled by the National Health Service Corps. And so my talk today is going to focus on that third word in National Health Service Corps, that of service. And that's going to be my teaching points to you today, Blake, Zane, and Colt, is to try and teach you of why I'm here, why I choose to be here, and why today I'm not at home with you. My hope is that my kids will have a central and integral part of their ethos of service in their life. That's my hope and my dream for my kids. So when I was breaking down service, I thought, well, let's see if I can come up with verbs and nouns for each of the letters in service. And these are my teaching points. And I'm not a perfect person. And I am still a work in progress as a person. That's why I'm here doing this Health Equity Fellowship. And by no means do I feel that I have achieved each one of these verbs and nouns that I aspire to achieve and improve myself at. But I think the S for me, I came up with a couple of things. I came up with service, of course, and serving, and selflessness. I don't always achieve that. I try to. And my hope is that through my work and that I've done, that I'm trying to put the needs of others who need it more than I do, need my time and my creativity and my talents to make their lives better. I hope that my kids are seeing that. There's been times where I've missed birthday parties because I've been in the hospital. But I hope that what they're learning is that it can't always be about oneself, that putting yourself before others, putting others before oneself is really important to do as much as possible. And then I think about the E, the first E in service, and that for me is education. I really, truly believe that education can be power, and it can be powerful. And my hope is that my kids will get an education to use that to improve the lives of others. I really feel that success is through education and using it to be better for others. When I think of the R, I came up with a couple of things. I came up with representation, came up with respect, and I came up with responsibility as important R words for me. With regards to representation, what do I mean by that? Well, my hope for my kids is that they will use their white privilege that they were born into to represent others who may not look like them. My hope is that they will open the doors for others that may not be able to open those doors. With regards to respect, my hope is that my children will respect others who may not have the same views as them, who may not look like them, who may come from other cultures. My hope is that they will respect and get to know these different people. With regards to responsibility, I think of a verse from Luke, "To whom much is giving, much is expected." And I know that in my role as a physician and in my privilege that I've been given, much is expected of me. And I hope that my kids will also feel that someday. When I got to the V, that was the tough one. That's the tough letter. So I had to resort to Latin. And for any native Latin speakers, excuse my Spanglish of veritas, truth. Blake, Zane, and Colt, the inconvenient truth in our country is that healthcare is a privilege. It's not a right. And to me, that's unjust. That's another reason that I'm here. I want to live in a world and in a country where that is no longer an inconvenient truth. I've seen people get preventable diseases in my career because they didn't have access to care. I've seen people die prematurely of chronic diseases that they shouldn't have, that could have been controlled. But again, it was an access to care issue. And this year, I've seen immigrants who are here legally in the United States declining health care because of the fear of the public charge rule, that if they were to accept Medicaid, they would no longer be eligible for their pathway to a green card or citizenship. To me, that's unjust, and that's not right. Blake, Zane, and Colt always tell the truth, even if it's an inconvenient truth, because only through stories of people that are negatively affected can we really change these inconvenient truths. When I come to the I think of inclusion. I've been so blessed to be included in this group here today with y'all and over the past year. My hope is that my children and my kids will not build walls, but will build bigger tables. I want us to have more people at the table and not build barriers. I want to break down those barriers and make our table bigger. When I think of C, I came up with a couple of verbs and nouns for C. Think of community. I think of caring. I want my kids to be part of a community larger than themselves. I want them to care for their fellow man and woman. I want them to be caring, loving people. When I get to the second E, I came up with emotion. Blake, Zane, and Colt, it's okay to cry. Tears of joy and also tears of mourning are okay. I want you to find your passion in life. I want you to be happy. I want you to temper your anger and use your anger to outsmart those who are angry at you, to change those inconvenient truths. I'm going to close with a couple of quotes that I only discovered this year thanks to the Health Equity Fellowship. One of them I discovered, is, I've told this story to you before, was at New York Avenue Presbyterian Church. And it's Micah 6:8. Show mercy. Be caring. Walk justly with your God. My hope for you, Blake, Zane, and Colt, is that you always have a faith and that will guide you at service and helping others, and making this place a better place. The second quote I discovered this year with y'all in Rwanda at the University of Global Health Equity. And it's a quote from Dr. Paul Farmer. This quote was on the lobby of the wall, and it went something to the extent of, all of our most significant accomplishments in life will be done working with others, or in a word, partnership. My charge to my children are make friends, have colleagues, because being by yourself is not fulfilling. Make a team, be part of a team, be part of a community. To you, my fellows, thank you for being partners with me this year, and I look forward to this lifelong partnership with you all. May peace be with us all, and thank you.